Hello, I'm Dr. Keith Allan. I'm a public health consultant with NHS Dumfries and Galloway. Just now we're seeing more and more cases of whooping cough in Dumfries and Galloway and across the whole of Scotland. Whooping cough is a bacterial infection of the lungs and airways. It spreads very easily through droplets in the coughs and sneezes of someone who has the disease. At first you'll see cold-like symptoms like a runny nose, a sore throat and a high temperature, but later the disease causes intense bouts of coughing and even trouble breathing. Whooping cough can cause severe illness, particularly in young unvaccinated children. Babies under 1 year old are most at risk. But the vaccine will reduce the risk. Babies should get 3 doses of vaccine at 8, 12 and 16 weeks old. Young children get another dose before they start school with their routine 4-in-1 jabs. We offer the vaccine to pregnant women as well to protect their babies for the first few vulnerable weeks after they're born until they're old enough to get vaccinated themselves. If you have a child, it's important that you make sure they're vaccinated against whooping cough. Talk to your healthcare professional if you want further advice, or visit www.nhsinform.scot/whooping cough. Thank you for listening.